will present today the second lecture on a series of 3 on the subject of female sexuality. This is an important subject. It's related to the development of female sexuality and male sexual development as well, to a type of resolution of the Oedipus Complex. And because there is a lot of confusion that we will try to clarify in this lecture. It may happen that patients with difficulties in these areas may not have a successful treatment because the therapists are not well aware of the complexities that are involved, the places where they need to look, and the problems and complexity of the subject. Now, once you clarify these things work out reasonably well. The title of the lecture today is on female sexual development, normality and pathology, and there you have the person that is talking to you today. Let's talk a little bit about the reasons for the neglect, confusion, and lack of understanding of the complexity of the female sexual development. Those of you that may have seen the first lecture, which is on the historical development of the concept and the complexities that did arise as the concept developed through the years, will be aware that for a long time the assumption was that the female Oedipus complex was similar to that of the boy, the only difference being the object that they have cathected. That is, the girl cathects the father in her Oedipus complex, the boy cathects the mother. The fact was that as time went by, some analysts came to consider that that was quite mistaken, that the female sexual development had 2 stages. Oedipus complex has 2 stages, a first phase and a second stage. First stage, second stage, you can call it first phase, second phase. The first one I have termed phallic Oedipal. And that was a phase that was described by analysts other than Freud, including people like Carl Abraham, Max Brunwitz, and Ruth Brunswick, and particularly by Lampel de Grue, a Dutch analyst that described this new phase that forms part of the Oedipal development of the female and not of the males, was described by her in 1927. And then a few years later, Freud accepted this formulation and included on his work on female sexuality that dates from 1931. Essentially what it means is that there is, between the anal stage and the Oedipal complex, where the girl cathects the father as the object of her interest, there is a previous phase, which, as I said, I call the phallic Oedipal stage, because in that stage she cathects the mother, just like the boy cathects the mother in his Oedipus complex. In this first stage of the girl's Oedipal development, she behaves like a boy, and I will give you some diagrams that clarify this. And it's a very complex subject, and that, of course, imply at the same time that terms that were used, like the negative complex, the inverted complex and so on, these acquire completely different meanings, and many analysts and many therapists are not aware of this complexity and how it is so, as I was saying, these different terms have different meanings, and in fact cover different developmental situations, different points of fixation in the development of the females, and consequently different types of conflicts and so on. Now, let's talk a little bit about the libidinal phases of development in both sexes. As you are well aware, libidinal development goes through the following phases. The oral phase, they have two stages, a passive and an active one. The anal phase, which have two sub-stages as well. And then for the boy, the phallic Oedipal phase, the Oedipus Complex, which you can see here, the diagram that essentially describes it. As you see, what you see on top with the arrow and the plus sign over here represents the bisexuality of all human beings. In the boy's Oedipal complex, the masculine aspects of his bisexual complex normally go and look for an object of the opposite sex. In this case, that will be the mother. And because this is the dominant part of it, we have either 3 pluses and 3 minuses with the father because he's the rival. Because everybody is bisexual, then female aspects of the bisexual complex of this boy will affect the father, but because this is in a much smaller, intense kind of situation, we put it in small letters with the father only 1 plus and the mother only 1 minus. And this is the representation of the female aspect of the boy's bisexual conflict. Over here you have what is called the inverted complex. And the inverted complex then means that for whatever reason, the mother was not present, the mother rejected the boy's cathexis and make it not desirable for him to cathect her, then that goes then to the object father with the 3 pluses. But because he already had cathected the father with the feminine aspects of his sexuality, then that is represented here. So in fact, this move over there and this is added to it. So that's why there are 4 pluses and 4 minuses. Now, somebody, a male that is fixated in this stage is in a masculine position, but his cathexis, instead of going as they normally do to a female object, have gone to a male object. And consequently, he is going to have significant conflicts with his sexuality and may, in extreme cases, particularly when the ego and the superego raise no objection, he will, from a masculine position, be interested in other males, and he may like to take the active role in a homosexual position. He may play the active male role. Now, what is interesting is that this is what was added by Lampe de Groot and discussed, as I said, by Abraham and Max Bromwich, and accepted by Freud and published on female sexuality in 1931, and became the girl's first Oedipal stage. As I mentioned a moment ago, the girl goes into an Oedipus complex in 2 stages. This is the first one, and is between the anal stage and the true Oedipal phase. So here, boys and girls have the same kind of a diagram. So that deals with the libidinal phases of development in both sexes, the order of them. And as I said, the important thing is to realize that at some point between the anal stage and the Oedipal phase in the females, there was another stage that they called the phallic Oedipal phase, which she behaved exactly like a boy. Now let's take a look at the diagram that clarifies this a little bit. Here you have what I was describing earlier. You have the Oedipus complex of the girl. Now, as you see, this is the first stage, and this is exactly like it was for the boy. And the second stage is called Oedipal, while this is called phallic Oedipal. And here, as you see, she finally has done a large number of things. Again, this represents the bisexual conflict. And here at this stage, since she is essentially in a kind of masculine position in terms of her bisexuality, is the masculine cathexis goes to the mother, and the negative and smaller side of her femininity at that point goes to the father. This is exactly like happened when the mother can accept that, and for whatever is not present or for whatever reason, then of course this inverted complex takes place, which means the object is changed from mother to father, but she remains in a masculine position, which is different from the move from the first to the second stage, because here she is, as you see, her bisexual constitution has modified itself, and the dominant factor now is the feminine ones, and they go for the father, which is an object of a masculine object, and this is a feminine cathexis, and the rival is the mother. And here you have the negative aspects of it that concern of her bisexual constitution, the masculine aspect. And here you have the inverted complex when the father doesn't accept that. Then it may revert itself to the mother. But notice the difference. Here she is cathecting the mother from a female position. In other words, she is a female. And is interested in other women, not in males. While here, and she there is doing that interest in other females is from a feminine position. Here, that interest in female is from a masculine position. And that of course has all kind of implications, as you will imagine. She gets fixated here. She has a masculine kind of interest in women, which means in extreme cases, if they are, as we said earlier, in the case of the Oedipus complex of the boy, if the ego and superego raises no particular objection, and these have a strong fixation, then she might become even a lesbian, but the active partner, or the one that plays the role of the boy in the lesbian relationship. And that, as you see, is quite different from this one, where she has from a masculine components and feminine components all go to the father, and she is still in a masculine position and is interested in males, not in females, but is interested in males from a masculine position, which means there are going to be conflicts with this, with men, unless they are very passive and can accept that kind of general attitude and what it represents behaviorally. So as you see, the confusion is clear. When you say positive Oedipus complex in a female, which one do you mean? Do you mean this one, or do you mean this one? They are very different. They are both called positive, but this one is from a masculine position and affects the mother. This one is from a feminine position and affects the father, and that's the normal, more normal position. As I told you, if by any chance that can happen, you may have an inverted complex, in which case you have the female component that is the dominant, interested in other women, but she wants to play a feminine role to another female, which may be this one, that is interested in women from a masculine position. Now, all of this happens at certain stages in the development of the human beings, and therapists need to look at those stages and around those ages and what kind of problems were taking place that led to these different developments. The other thing that is important to take into account is that the Oedipus complex is a constellation and may have elements of various types, as seen here, in different proportions. If the fixation is massive, then this won't take place. But if it is not massive, much of the cathexis and the change of object may take place, but there is a remnant left of this type, and all of that will influence people's behavior sexually. Now, let me remark on some other questions or develop them a little more. Now, if you look at this, the first stage has been called phallic Oedipal because during this stage, clitoridal activity is phase dominant, as contrasted with the second stage named Oedipal, when clitoridal activity tends to be suppressed more or less successfully. That doesn't mean to say that the clitoris doesn't play a role in the sexuality, of the girl, it does. And without his participation, the possibility of orgasm don't exist. But it happens too that at this point, obviously, the vagina doesn't necessarily play any significant role, even in the second stage, at the beginning, psychologically speaking, but many passive identification with the mother have started to acquire relevance. We will describe in the final lecture the questions of the difficulties of the concept of the vaginal orgasm and so on. Clearly, all orgasms require clitoral participation, and that's done by means of a mechanism discovered by Master and Johnson that we will describe in great detail in lecture 3. In the figures that this scheme that I am discussing, the square representing either the positive, negative, or inverted complex at each stage shows the object that receives the positive cathexis and its rival, which receives the negative cathexis. As I said, capital letters and 3 pluses and minus signs represent this object that receives the greater cathexis, while those that receive the less significant cathexis are represented by a small type and only 1 plus and 1 sign. The exception to that rule is the inverted complex that has 4 pluses and 4 minuses, because it adds to it, as I described to you, both the positive and negative aspects of the complex. Now, the former objects normally receive the cathexis from those elements of the bisexual complex that have the upper hand at a particular point in the development. The latter receive the cathexis corresponding to the less important bisexual counterpart, that is the negative complex, in, let's say, in this first stage or in the second stage that you have here. So there are 2 negative complexes, and you need to be very aware of which stage you are referring to, because though we use the same terms, it is confusing. If you look at the scheme, in the first stage, the negative complex is cathex the father from a feminine position. In the second stage, the so-called negative aspects of the Oedipus complex cathex the mother from the masculine side of the girl's bisexuality. So it is important to take that into account. As you see, the same is true of the inverted complexes. The first stage affects the father, which both masculine, which are dominant at this point, and feminine cathexis. And this may lead to fixations that essentially create problems of a certain type, because this inverted complex of the first stage, where the position is essentially from the bisexual point of view a masculine one, and goes to affect the father, means that the girl or the adult in the object choice will select males, or will have a not totally feminine attitude towards them, but it's a question of who wear the pants, kind of, which can create all kinds of difficulties in our male-dominated societies anyhow. And as you see, that inverted commas, inverted part of the complex, is again has two aspects. When you say inverted, you need to think of, are you talking of the first stage and what are the manifestations of it, which I already described a moment ago, and the second stage, and what are the manifestations of it. In the second stage, the inverted complex is completely different from the one on the first stage. The girl is in a dominant female position from the bisexual point of view, and that goes to the mother. And if there is a fixation at that point, you can imagine what the consequences may be. The same is true when you talk about positive complex. You have to say whether it is the first stage or the second stage, because there are enormous differences in terms of the object, the sexual position, the masculine, feminine attitude, and so on. So, since it is possible to divert the cathexis, feminine or masculine, to the wrong object, the symbols in the diagram that represent masculinity or femininity in the squares characterize further the aspect of the bisexual conflict from which the complex arises, and the length of the line indicates which aspects of bisexuality have the upper hand in each one of the constellations illustrated. The ego attitudes, beliefs, and fantasies cannot be represented in this diagram, but those that correspond to any of the constellations during the first stage are very similar, at least in a few fundamental essentials. The variations that have been observed are frequently determined by the direction of the cathexis to one or another object and the experiences, environmental situation, etc., that influence it. The same applies to those corresponding to the second stage, including the positive, negative, and inverted complexes. Naturally, and the fact that in order to move from the first stage of the female Oedipus complex to the second stage, there are changes that need to take place in 4 or 5 different plans of development. And let's take a look at that. The first one is that there has to be a change in the object. And if you look at the scheme, you see that in the first stage, where the masculine component of the bisexual elements of the girl at that age, which is shortly after the anal stage, are dominantly in a masculine position. She cathexes the mother. In order to move to the second stage, she needs to cathex the father. And in the transition to that space, to the first stage to the second, there is a change in the balance, in the bisexual balance of the girl, and there is all of a sudden a rush of femininity, and the female component of the bisexual elements are now very marked. So as you see, the change is from the object mother to the object father, and that's essential. As you see, there might be variations in one type of object is chosen, but that is due to abnormal difficulties in the development of the complex. There is as well a number of factors that concern the relationship between the clitoris and the vagina, and how and what are the mechanisms that in the adult female finally determine how the sexual female organs physiologically function. But we will discuss that in great detail in lecture 3. There is a change as well from a masculine to a feminine position, which just refer in terms of the change of object. And this is partly determined by innate factors and partly by certain ego developments that take place. And clearly, it is an important component of the development of the Oedipus Complex. As I explained a little earlier, when such things like in the inverted complex in the first stage change the object mother to the object father prematurely, and do so from a masculine position, that's bound to lead to difficulties of many types. So the change of the masculine to a feminine position is something that happens in the move. There is a change in the bisexual constitution, and as you know, typically the masculine elements of bisexuality tend to accept a feminine object. The female component of the bisexual conflict tend to accept a masculine object, except in situations where that is deviated for a variety of different reasons. Another line that we need to take into account is the change from activity, which is more typical of an active masculine female position, needs to be changed to a more receptive passive position. But what is meant here is activity and passivity. Here means being the penetrator or the penetrated, really, and accepted that role. On the ego side, which is another line that had to be changed and suffers changes during development, it requires the abandonment of belief in the universal existence of the penis, the acceptance of its absence in women, including herself, and of substitutes for its babies, the concomitant reduction of penis envy, the achievement of suitable feminine identifications, and concomitant changes in the conception of intercourse and of the fundamental fantasies about it. All of these changes are essential for a normal complex to take place. So that covers that particular aspect of the lines of development that need to be modified in the change from the first stage to the second stage. We discussed already the masculine and feminine positions and the basis of it in the bisexual conflict. And I mentioned that the active-passive equation has very many meanings. Activity, passivity. Here is strictly in being willing to receive and be penetrated rather than be the penetrator, and the attitudes that go with it. But active and passive mean many other things, including in the sexual behavior of human beings. And it doesn't necessarily, it certainly doesn't mean that women cannot be active in the sexual behavior in terms of doing things or initiating things or stimulating the male in a variety of different ways and so on. That has nothing to do with it. It's not that type of activity and passivity that we are referring to. That type of activity is perfectly normal. Now, the choice of an object is based essentially on the fact that in the bisexual constitution, the masculine cathexis, their dominant go for a female object. When that changed to the female dominance in the bisexual constitution over the masculine elements, then the female elements go to a masculine object in the normal condition. Though, as I mentioned, that can be changed and deviated for a variety of different conflicted situations. Now, there are, of course, a number of considerations that can be taken into account. Genetic events are important in terms of the strengths of the masculine and feminine components of the bisexual constitution, that there is some variability in different individuals. The parental ability to accept the girl's overtures in the different phases, or the boy overtures in his Oedipus complex by particularly the mother, and that's based, the attitude of the parents is not infrequently based as well in their own Oedipal positions and conflicts around it. Obviously, that will influence how they receive these cathexis from the children. Now, as you can see from the schemes that I have presented, the diagrams, there can be a large number of errors and much confusion that is created by calling the first stage, the first phase, phallic Oedipal pre-Oedipal, as if it were part of the anal stage of development, which it is not. It comes after the anal stage of development and is clearly a triangular position, father, mother, and child, which is not the situation in the anal stage, and that's why it is important to have it clearly in one's mind that this is an Oedipal stage which exists in the girl and not necessarily, not at all in the boy. Now, the role of sexuality is very significant in both boys and girls' Oedipus complex, and its resolution. Freud himself, as early as 1899, wrote, "Without taking bisexuality into account," and this is a quote, I think it would scarcely be possible to arrive at an understanding of the sexual manifestations that are actually to be observed in both men and women." So as you see, that early he was perfectly well aware of this significant role that is played by bisexuality. I mentioned already the role of the parents' constellation in terms of the Oedipus Complex, the different elements that constitute it, and how that will influence significantly the way that the cathexis of the children towards the Oedipal objects are received, whether well received or somewhat creating conflicts in the parents that may lead to the rejection of such cathexis and for such, and consequently to the possibility of the development of an inverted complex and so on. There is as well the ego experiences that the child has, which are, of course, very different in different families, with different parents, with different Oedipal constellation and different attitudes to children's sexuality and so on. There are some possible forms of conflicts and normal sexual positions and behaviors according to the level at which fixation may have taken place in any of the two stages of the Oedipus complex and the ego and superego attitudes to it, as I mentioned already earlier on. Let me again perhaps make some reference to it. Here is a boy phallic Oedipal stage, and I already mentioned and discussed this in that regard. Now, let's go to the Oedipus complex of the girl, and here you can see, and I already mentioned just to remind you, that for example somebody that is fixated to the square A in the first stage of the phallic Oedipal development of the girl is in a masculine possession affecting the mother. If that fixation remains, of course, when the displacement from mother to other female objects take place, this woman is in a masculine position, and as I told you, in extreme cases, and depending on the ego attitude and superego attitude, in extreme cases she may become a lesbian and taking the masculine role in the relationship. So that's obviously very important. I already mentioned that there are several forms of negative complex and that they are very different, and that leads to confusion. A square C, one of the first stage phallic Oedipal negative is very different from the negative complex of the second stage Oedipal. As you see in the first one, the girl is in a feminine position. I mean, it is a feminine cathexis of the bisexual constitution that cathect the father, while in the Oedipus complex second stage, it is the mother that is cathected by the masculine components, which are in a minority at this point. Femininity is dominant, so it's the masculine components that affect the mother, so they are very different. And it is important to pay attention to people's behaviors and fantasies, because that, I mean, sexual fantasies used, for example, for masturbation, or fantasies that people have sometimes during sexual activities and so on, because that gives you clues as to where the problems are and where they came from. So it is important to be aware of all of this and pay very close attention to these different factors and these difference that's significant. Now, let's take a brief look at so that essentially that constitutes most of what I have to tell you for this particular lecture. And here you have some information about the Carter-Jenkins Center, which is a non-profit organization devoted to the education of professionals and communities all over the world. Or if you want to see the self-learning programs on the behavioral sciences, as well as the lectures on mental health available free, you can visit our website at that address there. If you have any questions, you can address them to me at cgc.org, and if I have an answer that I can give you, I'll be glad to do so. Thank you for your attention.